And when Donald Trump was first elected, I was just like everybody else around me. I was just talking shit. I was saying that it was going to be a nuclear war. He was going to round up the blacks and the minorities, throw us all in a concentration camp. I said, I was just talking all type of ridiculousness. Matter of fact, when he won, I was in Cairo, Egypt at the time. And, I was on my laptop and I saw the news headline that said President-elect Donald Trump. And when I saw that, I flipped out. I just started running all around the mall screaming and yelling. And so, after that, I started to really pay attention because I thought that, America was just going down the drain, right? So I started to really pay attention, to what was coming from, what was coming from Trump, right? And so, he did something. I can't remember specifically what it was, but he did something. And I said, you know what? This is actually good. I said, I could see how this could benefit, our nation, our country. I said, I actually think this is really good. And so I went to someone who I highly respected, someone who, I thought to be an intellectual, someone who I thought to be a rational thinking person. And, I basically pointed out, this what Donald Trump did. And this person, she just yelled at me relentlessly for an hour straight. Just because I pointed out something great that he did. And so when that happened, I said, you know what? I think a lot of people may be doing the same thing. I think a lot of people aren't actually paying attention to, the positive aspects of this presidency and what he's doing. I think that everybody's just so overly concerned with the negative aspects. And if you say the name Trump, they're having a panic attack, a whole meltdown. And so, I said, you know what? Let me go try and do some research on my own, because a lot of stuff just wasn't adding up to me, right? And one thing in particular, they kept trying and say that, he was a racist, but I can recall, the NAACP giving him a reward, multiple awards for doing, for actually providing jobs in the black community. I can remember, him sponsoring a lot of black athletes and, black events. I mean, back in the day, he was our favorite guy. And, also, they tried to tie him to the KKK, but, and I'm from the South, and I've never known of the KKK to like Jewish people. Now, mind you, Trump's daughter is married to a Jew, and the same Jew is advising Trump. So I said, I've never seen a KKK member that would allow a Jew to advise him, let alone declare Jerusalem the capital of Israel. I said, this is one strange racist boy. So, I was born at night, but not last night. So I started to really think about all of this type of stuff. And so I started to do my little research, and I started to look into Trump's policies. And the first thing I said to myself, I said, you know what? I actually agree with the majority of these policies. I think he got some really, really great policies. I think that these policies can be really good for our country. And so beyond that, I started to really pay attention to Trump himself and, how he was conducting. For me, he's a businessman. I'm a businessman, and I saw him conducting business. And I said, you know what? This guy he's just moving through every single policy. All of his campaign promises, he's keeping it. I mean, this guy's literally, he said he's going to do that, boom, he done it. He said he's going to do this, boom, he done it. And we got to be honest. Barack Obama lied from the time he came in office to the time he left out. I mean, he barely took. He kept a few promises for a few people who looked like who paid him well. But Trump, Trump had no incentive. Nobody was paying him. He already has his own money. He came in this thing, just really ready to take care of business, really working for the American people. And that's what I started to see. And so I said, you know what? These guys are attacking him. Even when he was, about to meet with Kim Jong-un from North Korea, I said, wow, this is absolutely amazing. I was like, surely, no one can find something negative about that. And sure enough, they could find everything they possibly could. Oh, we don't think the meeting's going to go well. They could find everything they could say to try and disparage Trump, try and disparage anybody from even supporting Trump. And so, I did a lot of research. I started to look into the history of the Democratic Party. I started to look into the early history of the Republican Party. And I found out that there has been a huge effort to hide the true history of the Democratic Party. And, I went even deeper. I started to study, the Soviet Union era and the propaganda that's attached to the Soviet Union era and how they were able to effectively, subvert people's minds. They use psychological subversion techniques in order to, and they do this through the media and through the education system in order to completely change people's trains of thought, in order to completely change your mind. And so I saw how this, I saw like the correlation with these type of tactics from the Marx. I studied the Marxist Lenin's philosophy, socialism, communism, where was socialism at in societies? How effective was it? Why did it not work? I studied capitalism. I studied the whole correlation. I could see direct correlations between a lot of the stuff that the Soviets, with the propaganda and the Nazis were doing, within the Democratic Party, which absolutely blew my mind. And so then and then another thing that really struck out to me was, the destruction of the black family due to democratic liberal policies. Prior to the 1960s, less than 10% of black homes had a father in the home. And you look at modern day America now,
I'm going to make this video as quick as I can because I don't have a lot of time. Number one, we have got to get over the past and what's happened, okay? If you are white, understand that it is not your fault for what your ancestors, a lot of your ancestors did. The indigenous people here in America, land was taken from them. It was stolen. They were killed for it. That's not your fault. If you are a white American right now here and today, that's not your fault. Okay? Slavery. What happened? Horrible. What was done to my people? Okay? All of my ancestors, all where I come from, my blood that runs through my veins. What was done to my people? It was horrible. I won't even go into depths of it, but it was horrible. Killed, mutilated, mentally enslaved. Still to this day, it runs through our veins. But guess what? That is not your fault. If you are a white person right now looking at this video, that's not your fault. A lot of your ancestors did horrible things. And guess what? There were some of your ancestors who were on the side of right, who didn't want that. And they were killed right along with us and many other people. So we have got to come together as a people, as Americans now, put all of the stuff that's happened in the past, put it behind us. It's behind us. Doesn't mean we have to forget it, but just put it behind us. Don't hold you accountable who's here right now. Don't hold me accountable. Let's just all be Americans and stick together. Because let me tell you something. If my white friend or my white coworker or someone who I know or my white family member, if they tell me that something horrible happened to them or they're bothered and they're crying and they're upset about something going on, guess what I'm going to do? I'm going to be like, oh, hell no. Nah. You ain't going to mess with my friend like that. You ain't going to mess with my family member like that. And he can be white. And I'm going to stand up right there with him, arm in arm. We going down together. That's right. So we need to come together as Americans. Stop with this dumb shit. Get over it. It's behind us. We have children. We have kids. Do you want your kids to grow up in the same shit? I don't want mine to. I'm tired of it. Stand together. Come together. That's what we got to do now. Come together. I'm sick of it. And you should be sick of it. If you are not joining together, I don't want to hear about Trump, Biden, Democrat, Republican. I don't give a shit about none of them. All these politicians, all of them across the board are part of the problem. So if we're not coming together to support each other, this shit has gone on too long. We shouldn't still be having talks about racism. The racists, They should be a small minority. I mean, a small minority. But instead, we're allowing a small little group of people to control the masses. And I'm tired of it. I'm sick of it. I hope you're sick of it. Now let's come together and let's make a change, because I'm doing my part and I hope you're going to do your part.
It's been a very difficult decision to make whether I even wanted to do it. Less than a week ago, I was notified by the Board of Medical Practice in Minnesota that I was being investigated because of public statements I had made. They listed 2 allegations. They said I've been spreading misinformation in regards to the completion of death certificates on a news program, which happened to take place on April 7th. And you could find that one. It was with Chris Berg if you wanted to. And the other allegation was that I provided reckless advice in my willingness to compare COVID-19 and the flu. When I got this letter, I was ticked. And quite frankly, I leaned into the comfort and wisdom of my family to help them, let them talk me off the cliff. But doggone it, if this can happen to me, my view is it could happen to anybody. I mean, I've been a family doc for 40 years. I work hard. I love my patients. I do house calls. I've been medical director. I've held staff positions in hospitals to help make things work better. I've been in the Senate for 4 years and I've learned a lot. I've never had anything like this happen. Shoot a mile. 5 years ago, I was named the Minnesota Family Doctor of the Year in Minnesota. And I get this because a couple people complained, and I don't get to know who those people are. I don't know if they're routinely in a political camp, if they're activists. I've gone online and looked at what it takes to complete a complaint that the Board of Medical Practice has to follow up on. It's a one-page deal. You can say what you want. You could be a huge donor for the other party, and I wouldn't get to know it. I wouldn't get to know if you live in my district. I don't get to know anything. I checked. So here I am. I've spent the better part of the last 6 days preparing a response. I understand how important the work is that the Board of Medical Practice does. I mean, physicians do screw up. 2 of the big areas where physicians mess up is inappropriate sexual behavior, inappropriate self-medicating, certainly with opiates. But this is an odd position for me to be in. And I am just stunned. But I should have seen it coming, because I saw the threats on social media. I've seen them for the last 2 or 3 months. I've seen them come from physicians. I've seen them come from people in all walk of life. They didn't agree with me. They didn't like it, that I was trying to provide some context for the flu, for COVID-19. We've had some 35,000, 40,000 cases of COVID-19 in Minnesota thus far. According to the Department of Health people, that might translate into 10 times that many. And if it does translate into 10 times that many, that's 350,000 cases. But in 2018, we had more than 500,000 Minnesotans with the flu. When I say that, am I recklessly giving you advice regarding COVID-19 and the flu? Dr. Anthony Fauci has come out and compared them all the time. Dr. Mike Osterholm has. In terms of the death certificates, on April 3rd, I got an email from the Department of Health that said very clearly that we should report COVID-19 on death certificates if it is assumed to have caused or contributed. Well, that's not how we do death certificates. The official ICD-10 coding for April 1st, 2020 through September 30th, 2020, during the time frame in question, says this: if the provider documents suspected, possible, probable, or inconclusive COVID-19, do not assign U07.1, which is COVID-19 disease. It says, assign a code explaining the reason for the encounter, such as fever, or a cough, or shortness of breath. That's what the official instructions say. So I get this on April 3rd. I end up inadvertently, sort of accidentally, running it up the flagpole with Chris Berg on April 7th. And what happens? The Department of Health, a few days later, comes out with a clarification. And then a few weeks later, they come out with another clarification. And I appreciate it. Fact of the matter is, I'm proud of the Department of Health in Minnesota for saying we are not going to list non-confirmed cases as deaths in Minnesota. We are going to put an asterisk by them, and we'll follow up on those later. But that's not what Pennsylvania was doing. That's why they had to subtract 200 patients from their COVID-19 death count. Colorado did the same thing. New York went the other direction. New York said, we're having more deaths in a certain period than we normally have, so those deaths must be COVID-19. We just didn't pick them up. So never mind the testing. We're adding 3,700 to our total, and that does increase our total by 50%. So I'm in the position where I have to explain that I wasn't spreading misinformation. And I'm not being reckless when I talk about COVID-19 and influenza both being single-stranded RNA viruses that are respiratory in nature with similar symptoms and can be spread through particulate matter and aerosol transmission. I've got an 8-page document that I put together for the Board of Medical Practice. And let me be clear. They do important work, and I'm going to fully cooperate with them. I also have some 70 pages of attachments. And in the attachments, I've got the Pennsylvania Department of Health slashing their numbers by 201. I've got the Department of Health in Illinois, where one of the directors says that just because we put COVID-19 down on the death certificate as cause of death, that doesn't mean the patient died of COVID-19. She said that. Dr. Fauci, when he talks about influenza, he was the lead article in this New England Journal article, and he said this: if one assumes that the number of asymptomatic or minimally symptomatic cases for COVID-19 is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%. This suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza. That was Dr. Fauci. And, by the way, one of the contributing authors was Dr. Robert Redfield, the head of the CDC. Dr. Osterholm is a well-regarded epidemiologist. And he was saying this in the middle of March. He said, the flu has become a pandemic more than once and has killed millions of people. It still exists today. Unfortunately, we now have on our hands something else, but it's caused by coronavirus, which is acting very much like influenza. Folks, do I feel targeted? Yeah, I do. Do I know who my accusers are? No, I don't get to know. Could I be disciplined by the Board of Medical Practice? Well, sure I can. There's 2 allegations they're investigating. If I have been spreading misinformation, then what about Governor Walz and the Department of Health? Right around March 1st, we had a Department of Health memo that talked about the purpose of, if you will, some of the measures that would be taking to dampen, delay, and decrease the peak, to allow the accumulation of PPE and make sure that our hospital capacities weren't being overwhelmed. In that memo, they say what effective measures are: cover your mouth, don't go out if you have cough or fever, avoid touching your face, your eyes, or mouth, cover your mouth if you cough, wash your hands frequently, minimize outings, socially distance. But what did they say were not effective measures? They said wearing masks is not effective, taking antibiotics is not effective. A month later, Governor Walz comes out, talks about 74,000 Minnesotans dying. Later on, he went back to 29,000, and right around then, I put a different video out saying just the facts. And I said, I'm not buying 74,000 Minnesotans dying, I'm not buying 29,000. And then this one came out a month later, right around May 1st. This is a model that they're using. And it says on here, Minnesotans' model projects nearly 1,000 deaths a day in mid-July. Well, folks, that's next week. So far, we have less than, right around 1,500, of which all but 300 of them have occurred in people in long-term care facilities, in large part because the Department of Health participated in decisions that put people with active COVID-19 disease in the nursing homes. And I'm spreading misinformation. Of course I am. I don't know what to tell you. I just know this is wrong. We're in a bad place. My wife asked me the other day, Scott, why did 911 pull us together as Americans so much? And why is COVID-19 breaking us apart? I think physicians are part to blame. Scientists are. We've become so darn political. Physicians and scientists in the past are supposed to be above the fray. They're not. I have this odd set of hats I'm wearing because I'm the vice chair of the Health and Human Services Committee in the Senate, and I'm involved in policy discussions and involved in bills that deal with providing relief for COVID-19. And on the other hand, I've been a physician in the trenches for 35 years. So I try to connect the dots. I don't try to present myself to be something I'm not. I'm not an epidemiologist, but yes, I've taken epidemiology classes. I'm not an infectious disease doctor, but I take care of infectious disease every day. I just want to leave you with a couple of questions you could maybe ask yourself. Do we think it's okay for physicians to certify in death certificates that someone died of COVID-19, even if there was never a COVID-19 positive test obtained, even if there was never a COVID-19 test done, even if a COVID-19 test hadn't even been considered? And maybe the worst even if the family had no clue that the death certificate they received for their loved one was going to say COVID-19. What do we want to be doing there? In Minnesota, I think the Department of Health is taking care of business. Those are important questions. I'm sure there are naysayers out there that think that I'm getting exactly what I deserve. Fine. If it can happen to me, I think, frankly, that it could happen to anybody. It feels ugly. It feels like some of the people that disagree with me don't want to have a conversation. I've asked many of you to have conversations, and you've not been interested. So, reckless advice regarding comparisons between COVID-19 and the flu. Spreading misinformation because I cried foul when I received a memorandum from the Department of Health on April 3rd, which directed me to a CDC link, which says clearly that you could have a patient suffering from other medical problems, wheelchair bound, severe stroke within the preceding year or two, no COVID-19 test ever done or ordered, and when that patient dies of pneumonia, it's a COVID-19 death. I cried foul. And I'm grateful that the Department of Health a week later tried to clarify things, and a month later clarified it further. But I'll say it again. The official people who write the coding Bible in this country said, if the provider documents suspected, possible, probable, or inconclusive, do not assign COVID-19.